rates and variants and the infections in young people, challenges getting old people to get vaccinated, some questions about AstraZeneca. All right, here we go.
Okay.
Raywat Deonandan is an epidemiologist and an associate professor in the Faculty of Health Sciences at the University of Ottawa. He joins me now. Thank you for giving us some more of your time again tonight. Appreciate it.
Oh, thank you for having me.
Look, we seem to have this perhaps a worrisome intersection here of younger people aged 20 to 39 with the highest infection rates these days. They're down the list for vaccines. We have the rise in the variants and concerns about indoor gatherings of any size and perhaps restrictions being lifted. Are we in a dangerous period right now?
We're in a very dangerous period. The new variants, people need to understand, are showing hypertransmissibility and larger infection rates amongst the younger population. We're seeing an increase in hospitalization, more serious cases amongst young people, probably due to the new biological nature of some of these variants. So young people are newly vulnerable. In addition, they're more likely to socialize right now, and as you noted, are lower down the vaccination list. So they are a concerning demographic. And one thing about them that concerns me more so is we're not sure how to support them and discourage them. Because it's one thing to say, hey, young people, you're being bad in a patronizing, scolding tone, but some of them live in crowded housing. Some of them are frontline workers, grocery store clerks, baristas, that kind of thing, and they can't protect themselves. So what can we do from a policy standpoint to enable them to isolate and to be less exposed? That's unclear.
Yeah, and I guess one of the other issues, right, is because as you touched on, they tend to be more socially mobile and so on, which leads to the possibility of putting at risk those who are more vulnerable, family members, elderly members, and so on. So something else to watch for. Look, we are. You touched on it. We're still seeing an increase in the increase in the variants of concern, which are more transmissible. We're getting into the nice spring weather. Pandemic fatigue is, I think, heavy in a lot of parts of the country now. How satisfied are you with the public health measures in place at this critical time?
I'm not satisfied at all. I think much of the country is opening up when they should be either staying put or closing some things down. We're seeing exponential growth in places like Ontario, and it's only going to accelerate because, as noted, the new variants are hypertransmissible. We have schools that are open, for example, and not good enough surveillance in those schools to give us a good idea of where the transmission is happening. So if we're going to keep these things open, we should be investing in the public health assets to allow us to control the spread. Things like asymptomatic surveillance, things like better testing and tracing and isolation. And we're not doing that. So given that reality, I think we should really put a brake on the rate at which we're opening up society.
All right. Another area of concern, the vaccine uptake among seniors. In Ontario, for instance, just over 70% of people over 80 have been vaccinated or signed up for a shot. That leaves some 200,000 people in the province over 80 who haven't signed up yet, and they're the most vulnerable. Now, we know that today the Ontario government's announcing a $3.7 million funding program to transport seniors to the vaccination site. So that could make a difference. But how big of a problem is this?
It's a pretty big problem. And part of the issue is, do seniors have access to the sign up process? A lot of seniors aren't internet savvy, for example. Do they have loved ones who are helping them sign up? Many don't. And as noted, some haven't got transportation wherewithal to get to the place or even to understand the process of signing up and what it entails. So there are a lot of barriers still to be brought down, and I'm glad that we're addressing them one by one, but it has to happen faster. Part of this, of course, is vaccine hesitancy. And we talk around that a lot, but don't target it to the appropriate demographic in terms they can understand and things they care about. So we have a fair amount of work to do here still.
Vaccine hesitancy, and I guess I wonder how concerned you are about vaccine mixed messaging. We have the science advisor to the federal government, the top scientist in the country, saying now that we shouldn't be extending the time between doses for seniors to 4 months, saying, the research so far doesn't support that kind of a delay for seniors. I mean, how helpful is it to have the country's top scientists contradicting the public health officials at Health Canada saying, yeah, we can extend this dose period?
This is the nature of science. Robust debate is important and disagreement is important too. What the public needs to understand is we're actually not disagreeing heavily. What we're debating here and arguing about are the details of the plan. The one size fits all approach probably isn't appropriate here. So I think most people get behind the idea of maximizing the number of people we can get one dose into, with some exceptions based upon the science. So in this case, is maybe elderly people need to have their doses on schedule to make sure we don't have this immunosenescent effect, as we call it, or maybe some immunocompromised people have the same approach. So what we're seeing here in real time is working through the details as scientists do. Unfortunately, everything's under the public eye now, under deep scrutiny, and that leads to some confusion
Right.
and mistrust by the population. It's unfortunate. And if we had had years of planning, we probably could have put together a more robust public communications plan and not put everything under the public eye. But this is where we are. And
Let's finish.
unfortunately, we
Oh,
are,
sorry, finish up.
as someone said, we are building the plane as we're flying it, unfortunately.
Fair enough. Let's finish on this in the minute or so we have left. The AstraZeneca vaccine facing more scrutiny again today, with U.S. health officials questioning its efficacy. Claims of 79%, saying those results from the U.S. trials may have included outdated information. Still not approved in the U.S., but it's being used in Canada. What are your thoughts on that and the ongoing debate about AstraZeneca? Is how significant is it?
AstraZeneca is its own worst enemy. It just can't seem to do anything right in terms of public relations. In this case, it's an unforced error. They just should have included the more recent data, and they will soon. It's unclear why they didn't do that. So it's probably a fine vaccine. I will happily take this vaccine based upon what I've seen. The problem is now the public perceives a lack of transparency, and lack of transparency is seen as corruption, and that's seen as another reason for distrusting the vaccine. It's not helping, unfortunately. So we have to really gather our forces and re-communicate what the data actually mean to the public.
All right. Raywat Deonandan, always great to talk to you. Thanks again for your time tonight. Take care.
Thank you.
Thanks so much, Ray. That was wonderful as always. Take care of yourself.
Okay, bye-bye.
Okay, bye now.